The army was deployed there over the weekend.
Well, the Public Service Commission in Gauteng has welcomed the Health MEC, Bandile Masuku's apology. The MEC's remarks to overcrowding at the maternity ward at the Mamelodi Hospital were met with criticism. Masuku attributed the overcrowding to an administrative lapse. To discuss this, we are joined via Skype by Michael Selwane, Commissioner of the Public Service Commission. Commissioner, thank you for joining us. So there was this incident which was caught on video that shows overcrowding and the treatment of women who are breastfeeding as well as pregnant women at Mamelodi Hospital. It was followed by unfortunate, and that's an understatement, remarks by the MEC here in Gauteng, for which he has since apologized. But you believe there's something deeper to the situation?
Good morning to us, and good morning to the viewers. Firstly, let me start by extending our condolences to the families of the 54 people who have died out of coronavirus, and wish the more than 3,000 people who have tested positive a speedy recovery. With respect to the issue in Mamelodi, we welcomed the apology by the MEC, because the initial response, we were concerned about that one. However, the issues of Mamelodi Hospital, why we got into this one is because we've been engaging with Mamelodi Hospital about issues of overcrowding. And we saw those issues emerging again based on the problems that we have seen in the past. So we would have expected, out of engagement with the hospital last year, where management ensured to us that they are going to deal with the situation and they are going to implement constitutional values and principles, especially the issues of care to patients at all times. And with the lockdown regulations, we were concerned that it looks like social distancing measures are not taken into account, and that when people come to the hospital, they come there to get quality health care and not to be put at risk. So those were the issues that we were concerned. And then later on, when the MEC apologized to the responses that we had, we said, okay, that's fine, and we welcome that apology. However, the issues are broader than what came up. Mamelodi Hospital, when it started, it was a dark hospital. And then it covered only a small community in Mamelodi. And then later on, they extended it to Kalinen, to Easteres, to Mhlanga, to Mpumalanga broadly. And then now it cannot cope. So that's why we were under the impression that the hospital is still not addressing that issue. The department and Mamelodi are not addressing the issues.
Commissioner, I then have to ask you about the commitment that you mentioned you've received from the hospital. If the hospital is perhaps receiving so much pressure from the surrounding areas, which it has to house currently, and with the current lockdown, of course, enforcing social distancing as a priority, especially amongst patients and mothers who are about to give birth to young babies whose immune system is still fairly weak and still has to develop. I mean, what kind of commitment did you receive? What will they practically do to ensure that what we saw in that video footage does not occur again?
Yeah, with respect to that incident, and after engaging the department and even the hospital board yesterday, we got the impression that the issues are broader than overcrowding and social distancing. With respect to overcrowding, the hospital and the department has decided that after giving birth, the mothers must go home and then come back only for breastfeeding and stuff like that. Now, they were coming in and sitting in the benches outside, and the hospital staff did not deliberately put the patients at risk. They were trying, out of humanity and care for those mothers, to bring them in whilst they are waiting to breastfeed and then to go home. So the management has ensured that they are now, because there is no overcrowding in the hospital because of the lockdown, they put in the hospital beds, and then the mothers are cared for. The issues now are going beyond the healthcare issues. There are socio-economic issues, which we feel they can be addressed through the hospital management, engaging with the hospital board, which represent the community, and the social workers to deal with the deeper issues which makes mothers not to go home to and fro and deal with those issues.
Lastly, Commissioner, the situation we saw in Mamelodi, is it an aberration? Is it isolated, an exception to the norm in as far as the health system in Gauteng is concerned? For example, what would be the situation if one were to go to the maternity wards of other hospitals around the province?
Initially, we thought that it was an exception to the norm. But after engagement, we realized that these are the problems that they're dealing with are socio-economic issues, and also the issue that the hospital broadly is not able to cope. But this is a situation that we see in almost all the hospitals around Gauteng or national, wherein they have to deal with huge numbers from the poor communities in the country. And we're getting more concerned that some of the private hospitals are closing down as a result of COVID-19, and those patients are now going to be redirected to the public hospitals. But with respect to COVID, we also welcome the initiatives that the department has put across of ensuring that there is a hospital strictly for COVID-19 patients. So the nearby hospitals are not going to be dealing with COVID-19 patients.
All right, Commissioner Michael Silwane from the Public Service Commission, thank you so much for your insights this morning. Of course, the line starting to deteriorate there towards